You're climbing the stairs like usual, then halfway up there it is again. That sharp, nagging pain in your knee. Or maybe it shows up while getting out of your car, bending to pick something up, or during your morning walk. It's frustrating because the pain keeps coming back, but the source. That's not always so clear. Knee pain is tricky. What hurts isn't always where the problem started. And if you ignore those early signs, you risk losing flexibility, mobility, and confidence in your every step. But what if the exact location of your pain could actually tell you exactly what's wrong and how to fix it? Today, that's what we'll uncover. In this video, you're going to get clear, straightforward answers about your knee pain without the medical jargon. We'll walk through the exact location of your discomfort and explain what it means, what causes it, and what you can do about it. You'll learn simple ways to test your pain at home so you know exactly what's going on inside your knee. No guesswork, no overwhelm. You don't need to know every muscle or tendon, you just need to understand where it hurts and why. That clarity is what you'll get here. And the best part, the fixes we share are natural, proven, and practical. This is real guidance built from experience designed to help you move better starting today. 1. Front of the knee, runner's knee. When the front of your knee starts to hurt, especially right around or just beneath the kneecap, it can feel like something's off with every step. This type of pain usually flares up during squats, walking downstairs, cycling, or even standing after sitting for too long. It's often sharp, sometimes dull, but always persistent. What you're likely dealing with is patellofemoral pain syndrome, more commonly known as runner's knee. This issue isn't usually the result of one big injury. Instead, it builds up over time. The kneecap doesn't glide smoothly along its track, it shifts slightly off to the side, rubbing against the thigh bone underneath. Over time, that friction causes pain, inflammation, and discomfort with movement. A quick way to test for this is to perform a squat. If you feel pain or tightness at the bottom of the movement, you're likely experiencing this condition. What causes it? Most commonly, it comes from tight outer thigh muscles, specifically the iliotibial band, that pull the kneecap out of alignment. To relieve it, sit in a low chair, straighten your leg, and gently rotate it inward. Then use the heel of your hand to massage the outer lower thigh muscles, focusing on sore or tight spots. Do this for 30 to 60 seconds a day. Avoid jumping straight into intense leg workouts while symptoms persist. Give the area time to calm down. One bonus tip, many people with runner's knee also have weak glutes or internal leg rotation issues that worsen the misalignment. Strengthening the hips can be just as important as treating the knee directly. Runner's knee can be frustrating, but with the right steps, it's entirely manageable, and you can get back to moving pain-free. 2. Just below the kneecap. Patellar tendinopathy. If you feel a sharp, focused pain just below your kneecap, especially during or after activity that involves jumping, running, or deep squats, there's a good chance you're dealing with patellar tendinopathy, also known as jumper's knee. This pain usually settles right where the patellar tendon attaches to the top of your shin bone. It might start as mild discomfort and gradually build until it limits your movement entirely. Unlike injuries caused by sudden trauma, patellar tendinopathy comes from overuse. The tendon becomes irritated when the quadriceps muscle group repeatedly pulls on it with force, especially during activities like sprinting or squatting. A quick self-test is to sit with your leg extended and relaxed. Gently press on the area just below the kneecap. If it feels tender or sore, that's a strong sign of irritation in the tendon. To heal this, the first step is reducing the load on the tendon. That means avoiding high-impact activity or deep knee bending until the pain calms down. Stay within a 2 to 3 out of 10 pain level during any movement. Then begin a rehab routine with exercises like wall sits, slow body weight squats, and assisted split squats. These movements help strengthen the tendon gradually without overloading it. It's also important to watch for fat pad irritation, a condition that can mimic patellar tendinopathy. If pressing the sides of the tendon causes pain, or if the area feels puffy when the leg is straight fat pad, inflammation might also be present. Ice and rest can help in either case, but if the pain lingers or worsens, it's worth consulting a professional for imaging or further evaluation. With patience and the right approach, most cases of patellar tendinopathy improve significantly and your knees can return to full strength. 3. Just above the kneecap, quadriceps. Tendinopathy. Pain just above your kneecap, especially after squats, lunges, or uphill walks, could be a sign of quadriceps tendinopathy. This condition happens when the thick tendon connecting your thigh muscles to your kneecap becomes irritated from overuse, usually after a sudden spike in activity or training load. You might feel a dull ache that becomes sharper during movement. Pressing on the area just above the kneecap often reveals tenderness. The pain can sneak up on you first, showing up after workouts, then gradually becoming more constant if left unchecked. To test it, sit down, relax your leg, and gently press the area above your kneecap. If it's sore, you're likely dealing with quad tendinopathy. The good news: it's manageable without needing injections or surgery. Step 1 is to reduce high-impact activity. You don't have to stop moving, but focus on exercises that stay within a mild discomfort range, around 2 or 3 out of 10 on a pain scale. This keeps the tendon active without overstressing it. Rehab starts with slow, controlled strengthening wall, sits, assisted squats, and isometric holds. Avoid deep knee bends or fast eccentric movements in the early phase. Don't overstretch the quads either. It can worsen the irritation. Also check for deeper issues. Weak glutes or poor hip control can force the quads to do too much. Building strength in your hips often takes pressure off the knees and speeds up recovery. With smart rest and targeted rehab, most people recover well in a few weeks. Your knee isn't falling apart, it's just overworked. Give it what it needs and it'll come back stronger. 4. Red and swollen front, prepatellar bursitis. If the front of your knee feels swollen tender, or even a little red, especially after kneeling on hard surfaces, you may be dealing with prepatellar bursitis. It's one of the most common forms of knee swelling, caused by inflammation of the small, fluid-filled sac, the bursa, that sits in front of your kneecap. That sac is meant to cushion your kneecap from friction, but repeated pressure like gardening flooring work or scrubbing floors can irritate it and cause it to swell. You might notice a soft, squishy bulge that appears gradually or suddenly after activity. It can feel warm to the touch and slightly painful when you move your knee or apply pressure. The good news: it usually isn't serious, but it does require attention. Start by resting the knee and avoiding any kneeling or pressure. Apply ice several times a day for 10 to 15 minutes. Elevating your leg can also help reduce swelling. If it doesn't hurt too much, gentle movements like leg extensions can help keep things mobile. Avoid putting your knee on hard surfaces. When you return to normal activities, use knee pads or a cushion to protect the area. If the knee becomes redder, hotter, or painful to touch, or if you develop a fever, it could signal an infection. In that case, see your doctor right away. Antibiotics may be needed. Handled early, prepatellar bursitis can clear up in a few days to a week. Ignored, it can become chronic or infected. So listen to your body, take the pressure off, and give that knee the care it deserves. 5. Painful lump. Below the knee. Osgood-Schlatter. If you notice a hard, tender bump just below your kneecap, especially in active teens or young adults, it might be Osgood-Schlatter disease. Despite the name, it's not really a disease. It's an overuse condition that affects the growth plate, where the patellar tendon connects to the shin bone. This issue typically shows up during growth spurts, when bones are lengthening faster than muscles can keep up. It's common in kids who play sports involving jumping, sprinting, or quick direction changes like basketball, soccer, or gymnastics. But even adults who were highly active as teens can still feel occasional tenderness at that spot. You'll usually feel pain when kneeling, running, or climbing stairs. There may also be visible swelling or a hard bump where the tendon inserts below the knee. The bump itself isn't dangerous. It's your body's response to repeated stress pulling on the bone during growth. To manage it, rest and ice are your best tools. Cut back on high-impact activities for a few weeks. Ice the area after any activity, especially if it feels sore or inflamed. Avoid deep squats, jumping, or exercises that put stress directly on the knee joint. In most cases, the pain gradually subsides as the growth plate matures. But if it persists into adulthood, focus on strengthening your hamstrings, quads, and glutes to improve knee support. Gentle stretching and avoiding kneeling without protection can also help. The bump may remain even after symptoms fade, but the discomfort usually does not. With patience and smart care, this condition almost always improves on its own. 6. Inner knee, meniscus, tear, or ligament strain. Pain on the inner side of your knee, especially when twisting, squatting, or getting up from a low chair, could point to either a meniscus tear or an inner ligament strain. The key difference lies in how the pain behaves. If your knee feels like it catches locks or gives way unexpectedly, the likely culprit is a meniscus tear, a small piece of cartilage inside your knee that acts like a shock absorber. You can test this by bending your knee to 90 degrees and pressing your thumb into the inner joint line just below the kneecap. If it's sore or creates a deep ache, there's a good chance the meniscus is irritated or torn. Meniscus injuries often come from a sudden twist or awkward movement, but they can also develop gradually with age. Small tears, especially in the outer third of the meniscus, have decent blood flow and may heal on their own. Start with heel slides, straight leg raises, and avoid anything that requires deep bending or twisting. Now, if the pain is more generalized, dull, and linked to a specific event like a misstep or an inward collapse of the knee, it could be an MCL strain, medial collateral ligament. These strains heal well with rest ice and compression in the first 72 hours. Whichever it is, avoid aggravating movements for a few weeks. If symptoms persist or worsen, an MRI can confirm the diagnosis. Early action often prevents bigger problems. The sooner you support your healing, the sooner your knee will support you again safely and pain-free. 7. Outer knee, IT band syndrome. If you're feeling a sharp burning pain on the outer side of your knee, especially after running, cycling, or walking downhill, you may be dealing with iliotibial band syndrome, ITBS. It's one of the most common overuse injuries in active adults and often misunderstood. The IT band is a thick strip of connective tissue that runs from your hip down to your shin. When the muscles around it become tight or imbalanced, particularly the outer thigh and hip, it can cause the band to rub against the outer knee bone, leading to irritation and inflammation. This pain often kicks in around the 10-15 minute mark of activity and may worsen with repeated bending and straightening of the knee. You might even hear or feel a clicking sensation. One way to test it: bend your knee to about 30 degrees and apply pressure to the outer part of your knee. If that replicates your pain, it's a strong sign of ITBS. Treatment starts with reducing repetitive activities that worsen symptoms. Temporarily cut back on running or cycling and switch to low-impact alternatives like swimming or walking on flat ground. Then use the heel of your hand to massage the outer thigh, focusing on tight sore spots for 30-60 seconds per day. This simple technique can dramatically release tension in the IT band. Long-term focus on strengthening the glutes and hip stabilizers to prevent recurrence. If you have structural issues like bow legs or a leg length difference, consider seeing a professional for orthotics or inserts to rebalance your alignment. With smart rest massage and proper training, IT band syndrome is entirely reversible. You don't have to stop moving, you just need to move smarter. 8. Behind the knee, popliteal strain, or Baker's cyst. If you're noticing a tight aching sensation behind your knee, Especially when walking downhill, climbing stairs, or standing for long periods, there's a good chance it involves the popliteal muscle, a small but important stabilizer at the back of the knee. A popliteal strain happens when this muscle becomes overloaded, often from downhill walking, hiking, or improper movement mechanics. The discomfort may feel deep within the crease of the knee, and you may sense a bit of stiffness or pressure, especially when bending. Treatment is straightforward rest and reduce strain on the area for a few days. Choose flat surfaces when walking and wear shoes with strong arch support to minimize overpronation. Gentle hamstring and calf stretches may help release tension in the back of the leg, but avoid deep bends or stretches that worsen the pain. Now, if instead of muscle soreness you feel a round, squishy lump behind your knee, especially when the joint is swollen, it may be a Baker's cyst. This fluid-filled sac forms when there's inflammation inside the knee, often due to arthritis or a meniscus tear. The cyst isn't dangerous, but it can feel tight and uncomfortable, especially during movement. In many cases, Baker's cysts shrink or disappear with conservative care. Rest, gentle movement, and addressing the underlying cause like inflammation or instability can make a big difference. If the cyst is large, persistent, or painful, an ultrasound or MRI may help confirm the diagnosis and rule out more serious issues. Don't ignore pain behind the knee. Whether it's muscular or a cyst your body is asking for, adjustment, not avoidance. With early care and proper support, full recovery is absolutely possible. 9. Below. Joint on outer side. Tibiofibular joint dysfunction. If you're feeling a sharp, localized pain just below the outer side of your knee, right on that small bony bump near the top of your shin, the issue might not be in your knee joint at all, but in the proximal tibiofibular joint. This small but important joint connects your shin bone tibia to the smaller bone on the outside of your leg fibula. Pain here is often misdiagnosed because it mimics other conditions like IT band syndrome or general outer knee pain. But what makes it unique is the pinpoint location right where the fibula meets the tibia. This joint can become irritated from kneeling on hard surfaces, sitting cross-legged for long periods, or repetitive twisting motions. It may feel tender to the touch, especially when you bend your knee to 90 degrees and press gently on that outer bump. If moving the fibula forward and back causes discomfort, this confirms it's the likely source. The good news: it's treatable with gentle mobilization and rest. Using your fingers, you can perform a small forward and back pressure motion on that bony area once or twice daily, just 30 seconds at a time. Start slowly and never force it. If the joint feels sore or swollen afterward, ice it for 10-15 minutes and give it a day off before trying again. Avoid positions that compress the area, like kneeling, deep lunges, or squatting with narrow foot placement until symptoms calm down. Supportive footwear also helps, especially if you tend to walk with your feet turned out or have instability in the ankle or hip. Though small, this joint plays a vital role in knee stability. Listen to it early and you'll avoid bigger issues later. 10. Below, joint on inner side, pes anserine bursitis. If you're feeling a dull, nagging ache on the inside of your knee just slightly below the joint line, especially after climbing stairs or rising from a seated position, you may be dealing with pes anserine bursitis, a condition that often flies under the radar but affects thousands, especially middle-aged adults and those who are overweight. The pes anserine area is where 3 tendons from your thigh muscles come together and insert on the inner shin bone. Just beneath that spot lies a small fluid-filled sac called a bursa, which helps reduce friction. But when these tendons become tight or overworked, or your leg alignment is off, that bursa gets irritated and it starts to hurt. Common triggers include overuse, poor biomechanics, like flat feet or internal leg rotation or tight hamstrings and adductors. Women tend to experience this more often due to hip structure, but it can happen to anyone. You can test it by pressing gently on the area about 2 to 3 centimeters below the inner knee. If it's tender, puffy, or sore with light exercise, that's a strong sign. The pain might also intensify at night or after climbing stairs. To manage it at home, ice the area for 10 to 15 minutes after activity and reduce repetitive knee movements. Avoid kneeling or deep side lunges for now. Then begin strengthening exercises for the glutes and hamstrings, which help stabilize the knee from above and reduce strain below. Also work on correcting internal rotation. This means supporting your foot arch and improving hip control. Pes anserine bursitis usually responds well to conservative care. Listen to your body take a step back when needed and restore balance, because prevention isn't about doing less, it's about doing things better. 11. Generalized inner knee pain. Osteoarthritis. If your knee pain feels deep, dull, and constant, especially on the inner side of the joint, and tends to get worse with weather changes, long rest, or first thing in the morning, you might be facing osteoarthritis. It's one of the most common causes of chronic knee discomfort, particularly in adults over 50. Unlike sharp pain from an injury, arthritis pain builds slowly. You may feel stiffness after sitting, grinding or creaking sounds when you move, or swelling that comes and goes. It's often most noticeable when transitioning from rest to movement, like getting out of bed or rising from a chair. Osteoarthritis occurs when the protective cartilage in your knee wears down over time, leading to bone-on-bone contact joint inflammation and reduced mobility. Though the condition isn't reversible, the good news is it's highly manageable. Your first line of defense is movement. While it may seem counterintuitive, gentle exercises like heel slides, leg raises, and short walking intervals help keep the joint mobile and reduce stiffness. The goal isn't intensity, it's consistency. A few minutes each day is better than an hour once a week. You'll also want to support the muscles around the knee, especially your quadriceps and glutes. Stronger muscles reduce the stress on your joint and improve alignment. Avoid high-impact activities like running or jumping, and opt for low-impact routines like swimming, stationary biking, or using an elliptical. A supportive shoe and even custom orthotics can help redistribute pressure and ease pain during daily activity. If swelling flares up, ice the area and consider speaking with a professional about anti-inflammatory options. Remember, osteoarthritis doesn't have to mean the end of mobility. With steady care and smart movement, your knees can keep supporting you for years to come. 12. The hidden root causes. Internal leg rotation, weak glutes, flat feet. Sometimes the real reason your knee hurts isn't the knee at all. It's what's happening above or below it, specifically in your hips and feet. If you've tried stretching, icing, or foam rolling, but your knee pain keeps coming back, it may be time to address these hidden root causes: internal leg rotation, flat feet, and weak outer glutes. Let's break that down. Internal leg rotation happens when your thigh rolls slightly inward as you move, often caused by collapsed arches, flat feet, or weakness in the gluteus medius and gluteus maximus. This rotation twists the knee joint out of alignment, putting extra strain on cartilage, tendons, and ligaments with every step. Think of your leg as a chain. When one link is off, the whole system struggles. Start from the ground up. If your foot flattens when you walk, you're likely overpronating. This collapses the arch and rotates your shin inward, affecting the knee's tracking. Try supportive shoes made for pronation, or consider orthotic inserts. Begin with short foot exercises, a small but powerful way to train your foot to lift and stabilize properly. Next, look at your hips. Weak glutes can't hold your pelvis steady, so your thigh compensates by rotating inward. To counter this, practice standing on one leg, shifting your pelvis gently side to side, and doing slow, controlled hip hinges. You don't need fancy equipment, just body awareness and repetition. These fixes won't just reduce pain. They'll change how your knees move, how your muscles work together, and how confident you feel walking, climbing stairs, or getting out of bed. Heal the foot, strengthen the hip, and you'll protect the joint in between the knee. Now that you know what's causing your pain, here's how to fix it naturally. Understanding your knee pain is only half the battle. The real progress begins when you take simple, structured action. And the good news, you don't need fancy machines, endless physical therapy visits, or complex routines. All you need is consistency, patience, and a plan that works with your body, not against it. Here's a proven 3-phase routine you can start today. Days 1-7. Focus on reducing stress and inflammation. Limit deep squats, running, or any high-impact activity. Instead, apply daily outer thigh massages, use cold packs on sore spots, and start gentle glute and foot arch activation exercises. These early movements retrain your alignment and allow inflamed tissue to settle down. Days 8-14. Begin low-impact mobility work. Wall sit short foot drills and controlled straight leg raises help build foundational strength without aggravating the joint. Keep the range within comfort and don't push through sharp pain. Think of this phase as rebooting the connection between your brain muscles and joint mechanics. Days 15-30. Now it's time to rebuild strength and restore function. Add in exercises like glute bridges, slow lunges, standing pelvic tilts, and light stair work. Focus on posture, foot control, and knee alignment throughout each movement. You're not just moving, you're re-educating your body to move better. The healing process isn't about perfection. It's about progress. One well-aligned step today leads to more freedom tomorrow. You may have thought your knee was just getting old, but often it's simply overwhelmed. With the right support, it can reset, recover, and even come back stronger than before. Every day you show up for your knees, they'll show up for you in every walk, climb, or dance step to come. If this helped, let's keep going together. Now that you've made it to the end, chances are something in this video connected with you. Maybe you recognized your own knee pain. Maybe you finally understand why your knee has been holding you back. And more importantly, you now know what to do next. So here's how we keep the momentum going. If any part of this video described the exact pain you're feeling, go ahead and hit that like button. It's a small gesture that tells the algorithm this kind of content matters. And more than that, it helps others who are searching for answers find the same clarity you just received. Drop a comment below and let us know. Where exactly is your knee pain? What triggers it? What's helped you so far? Your insight could be the key someone else needs. We read every comment, and this channel grows stronger because of your shared experience. And if you haven't yet, subscribe. We release new health guides and movement-based fixes every week designed especially for people who want to move better, age stronger, and feel confident in their own body again. Because every step you take should feel strong, not scary. Every stair, every walk, every stretch should feel like you're moving forward, not falling behind. And that's exactly what this channel is here for. This is your place to learn, heal, and stay one step ahead. We've only just begun.